All right, hey everybody, this is Matt Shu from Upright Health, and I am here with Jacqueline over on the East Coast,
Atlanta.
out in Atlanta. And Jacqueline has had some issues for with her hips for quite a while, basically her whole life, and she agreed to share her story with us. So, Jacqueline, first of all, thank you very much for being willing to share the story. It'll be really helpful for a lot of people. And second, let's talk about your hips. Can you give people an overview of your hip issues over the course of your life?
So basically, I was born with congenital hip dysplasia, and it wasn't discovered until I was 2 years old. So I got an osteotomy to fix it, and they basically reshape your pelvis and then make a hip socket using other bones from your iliac. So that was a pretty major surgery. I was in a body cast forever, like months, and then I was pain free until age 25, but I did have to quit some sports teams and make some adjustments along the way.
Mm-hmm.
But overall, no major issues until 25 when I was skiing, tennis, yoga, way too much yoga. And then I just started becoming in pain every day on the operated hip on the right side.
Okay, so once the pain started setting in, what did you do? What kind of treatments did you seek out? What kind of diagnoses did you get?
So I had an MRI arthrogram. I had already had physical therapy for 4 months at that time. Um, and I just wasn't seeing any results. I kind of felt like they didn't really know what to do with me.
Mm-hmm.
And I had been diagnosed with labral tears on both sides.
Okay.
So I was facing, two surgeries, which was very alarming. So,
So then you had the test, you had the MRI arthrogram, and
mhm.
then you were told so surgery was going to be the thing to do
So
on both
they
hips.
recommended surgery immediately. They were like, you definitely need surgery. There's no point in delaying it. You're not going to fix this with physical therapy. Nobody gets better. That's what the first surgeon said, even with PT, which I knew then wasn't true because there were people at my PT place that I had been religiously going through to that had labral tears that had seen results with exercise.
Okay.
So I was like, okay, I need to get a second opinion. This
Okay.
guy's just like all in. Um, he was like, basically, there's no hope. You're gonna um, need this sooner or later, or you're gonna have terrible arthritis and be in pain until then.
Okay.
Um, and I did have a little bit of like thinning of the cartilage. So he's like, it's already starting, your arthritis.
Okay.
I was like,
How old were
but
you at that time?
25. This was like 5 months ago or 4 months ago.
So so once you were told, you need to deal with your muscle stuff, then what was your next step?
Um, Then I'm trying to remember. Oh, I had been doing the FAI Fix
Okay,
since,
so let's talk about that. So then, how did you
yeah,
find the
being
FAI
back
fix?
on that one. So basically, I had gone on vacation for my birthday and I was in terrible pain the whole time. And I was Googling on the way home. My friend was driving and I found the FAI Fix and I bought it immediately and started doing it because scenario two described exactly my scenario, which was you've probably been doing yoga for 2 years. And there's a such thing as
All
hyperflexibility,
right.
which is exactly what I had been experiencing. I had gotten really into yoga. I quit all my other intense sporting activities in hopes that yoga would help me,
Mm-hmm.
but really it seemed to be making things worse, which is kind of counterintuitive if you don't really understand the problem.
Right. Yep. Yep.
So, sadly, yoga was my downfall.
Okay.
But
Okay.
so then I was like, this is exactly me. I have to do this. So I started doing it. Initially, it helped a lot. Then I plateaued
Okay. Yeah.
and I just couldn't quite. My pain was still like a one or a two. Like I was never having like really really bad times where I was kind of freaking out,
Mm-hmm.
but or like sitting at dinner with friends being like, oh my god, I want to go home. Like I wasn't having that anymore,
Okay.
but it still was like standing at work, kind of in pain constantly. So then I found Upright Health and I signed up for a Skype appointment.
Mm-hmm.
And you predicted that by September 2nd, I could deadlift 90 pounds, which was true. And then you predicted that things, which I never would have believed in a million years because I'd never done any weightlifting pretty much ever. And then you also predicted that things would stabilize and I would start feeling some relief by then, which was also true.
Yes.
So, yeah. So basically from September 2nd until like October, maybe like first week in October, I was like pain-free and super excited about it. And I had a flare-up for a couple weeks, and then now I'm better.
All right. Right. So for people who are, kind of just trying to get a handle on what it all means for you to make things better, can you kind of explain, from your perspective, what the process is like of making things feel better?
So there's kind of like, with me, there's two types of things that I feel like are going on. Like my actual hip will be hurting, and then my muscles will be super knotted up and get like tight and bad feeling and just knotty. Like
Okay.
makes you want to foam roll all day long, and then foam rolling doesn't fix it,
Okay.
basically.
Mm-hmm.
So now the knotting up, the like dysfunction feeling is gone.
Okay.
And I'll occasionally have a twinge of like pain in my actual hip,
Mm-hmm.
but it's not this whole like leg pain, like all these other muscles, no back pain. No, and I was having lower back pain for like a month that was getting really bad in the summer. And that was gone like right when I started adding weight to my program. So
Right.
that was a huge relief, and I just felt like things were starting to really stabilize like pretty immediately with the
Mm-hmm.
back stuff. Because my back had been pop, pop, pop every time I do anything. Like get out of the car, pop, pop, pop. And then right when I started doing these heavier weights,
Mm-hmm.
the back like stabilized, no more popping, no more pain.
How are you feeling, just in terms of your hips these days? Your forward outlook. What are you thinking?
I am super hopeful and excited. And I'm starting to get back into all the things I used to like to do. Not yoga, but
Yoga. Yeah.
I mean, my yogi days are over. I just don't want to loosen anything up anymore than it
Mm-hmm.
already is now. So I've been doing biking a little bit, and I've been doing walking to get ready for a hiking trip that I'm going on. And I've done a couple bigger hikes, and they've gone really well.
Nice.
And I've done horseback riding, and
Oh,
that one as well. Yeah.
nice. Nice.
So, and I'm going horseback riding again on my big hiking trip for like a hardcore ride. So
Awesome.
I'm really excited about that. And I didn't have any pain after any of those practice runs. So I'm super pumped. Yeah, and people also, I want to tell them that it's not linear and don't be freaked out when you have a flare up or a setback because it is temporary, even though it feels like you might be starting from square one. There's a lot of anxiety related to being in pain that's hard to understand and seems unpredictable. And it is, but once you start to figure it out, there's so much relief and peace that comes with that too. So not linear for anyone, it seems like.
Yeah. Again, really good point. It really never seems to be linear for anybody. It was never linear for me. It's not linear for a lot of clients. It's you make progress, and then you come up against new roadblocks, and then you need to figure out what you need to do to adjust. And you've been doing that with me pretty well here. So it's been a pleasure to watch, and it's great that you're sharing that with people and making sure they know that too, because it can be frustrating and it can be discouraging sometimes if you don't know that that's coming.
It's
Right?
scary,
Yeah.
but you get past it and then you're back to feeling good again.
Awesome.
Why was I freaking out?
What's that?
And then you're like, why was I freaking out?
Oh, yeah. Is there anything else you'd like to add, Jacqueline? Any other words of wisdom or anything else you want to mention about your journey?
I guess the main thing that makes me different and what I was really concerned about this method not working is that I did have such severe hip dysplasia and I did have the osteotomy. I was just like, are my bones just too messed up for this method to work?
Mm-hmm.
So if there's anyone else out there that has had that kind of major pelvic surgery and does have those abnormalities, they can know now that it is possible. Even if you have not just FAI, but some of these other things colluding your issues.
Right. Well, Jacqueline, thank you so much for joining me on this call and taking the time to share this story. It's super helpful. I know there's a lot of people out there who will find this helpful. So thanks for your effort and thanks for your faith.
Thanks for helping me and listening to me freak out when I have painful flare-ups.